start.
I'm here with Dr. Mark Deist, an ophthalmologist here at the Sandhurst Eye Centre. Dr. Deist, please can you tell us how COVID-19 is panning out in South Africa?
Okay, well, I'd like to make a disclosure that one, I'm not an epidemiologist nor a mathematical modelist, but I'd like to appeal to my patient base to listen to the following things, and these are based on questions I'm typically asked. So in the world, I've chosen not to look at the modeling numbers. They can be quite ghastly and in some cases inaccurate, but have chosen to look at where real epidemics have happened. For example, in the two ships, the Diamond Princess and the Theodore Roosevelt, they had, and in fact in a hamlet in Germany, which is a little village, they had a very, very contained epidemic in each of these events. And out of this, some very important information has crept into our understanding. One, that the asymptomatic carriers can be as high as 80% in society. And that means people don't even know they have this virus, and they can have a totally asymptomatic passage. They do, of course, transmit the disease, but it's been shown that asymptomatic carriers transmit much less virus than actively sick people. The fact that it's a predominantly young person who recovers fully from this disease, making a very small percentage of people that get ill from this disease, and this has been shown in these epidemics, and particularly the elderly and the people with comorbidities. For example, the metabolic syndrome, which is diabetes, hypertension, cholesterol, and people who've had heart attacks, folk that have malignancy, immunocompromised, active TB folk, and of course a new-ish risk factor are people with a BMI over 30, and these folk, of course, also form part of this metabolic syndrome. And the vast majority of people recover from this. It's not a particularly dangerous disease. It is, however, according to these little epidemic studies, a very, very infectious disease. And it's also been shown that things like social distancing with wearing of masks and the frequent washing of hands has a dramatic effect on the transmission of these viruses. But that's in general. If you look at the death rates in these countries, you can obviously see the spike throughout the world, that over this period of time there have been more deaths than usual. But if you look at South Africa and countries like South Africa that have a low to medium economy countries, low income to medium economy countries, the death rate is very low. For example, South Africa has an 8 per million death rate as we speak, compared to, say, Belgium that has over 800 deaths per million. And this may well be significant, and we see across all of these countries with the low socio-economic to middle socio-economic regions, this similar pattern of a very low death rate associated with relatively high numbers of cases. We also see a high number of recovery in these countries, and they think it's probably due to a form of T-cell immunity, which doesn't necessarily build up antibodies, and this theoretical herd immunity of 70% may well not be applicable in our countries, where the virus starts dropping when they get to about 25% of the population. And this is due to this so-called cellular immunity. And whether BCG vaccinations have anything to do with it, it may be part of it. The other major factor, of course, is we live in a very young country. Our average age is 26, compared to the UK and Spain and Belgium, where the average age is north of 65. So what we're seeing in this country is is generally high numbers with a very, very low death rate. We are seeing the risk factor group come out. And we're also seeing hotspots, like, for example, the Western Cape. And this hotspot, I believe, is due to social disobedience. I believe very few of those folk practice the usual antiviral epidemic measures like social distancing, mask wearing, and hand washing. But time will tell.
And Gauteng, how do you see Gauteng as a hotspot or not hotspot area?
Gauteng, I think the citizens have largely obeyed the social distancing, mask wearing, and hand washing protocol, and we're now seeing recovered people more than the active people, which is a very good sign that we deserve our easing of our lockdown into category 3 and hopefully better than that. But it seems like Gauteng is managing this problem very, very well indeed.
And what is the COVID compliance in your practice and at the Sandhurst Eye Centre? What measures have been put into place?
Yes, so as per any viral epidemic, it's been shown since Florence Nightingale's time that you manage these things by social distancing, washing of hands, and wearing of masks. But we've introduced, and based on international experience, a whole set of protocols which we call our Covert Compliance. And this starts at the gate of our facility, where we have staff members that look for temperature rises. They ask a questionnaire of previous illness and symptoms peculiar to COVID. They then get a green sticker which allows them to enter the facility. They have also been spoken to by the reception staff prior to even arriving here, whether they have any of the COVID contacts or symptoms. So by the time the individual or patient enters our facility, we're pretty confident that they don't have active disease. Of course, our staff are all COVID compliant, and we've all had COVID tests, and we practice mask wearing, sanitization, surface sanitization, barriers, and as a consequence, we believe our facility is safe for patients coming in, and our staff are therefore also protected, and we can proudly say we are a COVID-safe facility.
And what are your views on the societal anxiety caused by the corona in South Africa?
Yeah, I'm very concerned about this concept of COVID angst or lockdown addiction, where people have become so terrified, and I think social media and maybe some of the ghastly numbers that have been put into social media, which I believe will be proven to be totally inaccurate, have resulted in folk being too scared to attend to their health care. And the consequence of delaying health care may have serious consequences down the line. Now, for example, simple cataract surgery, folk with cataracts, if you leave them, they advance and your vision becomes poorer and your contrast sensitivity weakens and becomes poorer. The net result is you may trip and fall and break a hip. You may have a motor vehicle accident. And in fact, they've shown that the quality of life deteriorates markedly with poor vision, and some folk become depressed. And we've actually seen statistics whereby mortality is higher in folk that have untreated cataracts. Your glaucoma deteriorates. You may get a contact lens infection, and you may well find that you get an ulcer that gives an abscess. You may land up needing a corneal transplant. So my appeal for ophthalmic patients, don't delay your ophthalmic or your eye healthcare. It may have consequences. On a more general note, we're seeing the vaccination programs in the world suffering. The WHO has just announced that they fear that 80 million 1-year-old or infant children may not get their measles and rubella and mumps vaccinations, and the mortality from measles may go up and make the mortality from COVID a very small problem. So please, the appeal is not to delay getting your healthcare if you feel you need healthcare.
And are there specific groups in society that are at more risk of COVID complications?
So we're seeing it throughout the world, and South Africa no exception, and the Western Cape certainly no exception, that the folk landing up in hospital are the people with these comorbidities. And I loosely term a metabolic syndrome, and it's this type 2 diabetes, it's uncontrolled blood pressure, and it's uncontrolled cholesterol, giving rise to cardiovascular disease. These folk seem to have an inflammatory predisposition to getting this virus, and when they get it, they get desperately ill, and they get this inflammatory process that attacks their blood vessel lining, and they get millions of little clotting episodes that land up in their lungs and their kidneys and their heart. And of course, they are the folk that get desperately ill in ICU. The folk that have BMIs over 30, well, they kind of go hand in hand with this metabolic syndrome. They're also at risk. So that has been a worldwide phenomena, and that will need to be addressed once this COVID pandemic is over.
And how safe would you say is it to have surgery during this time?
Well, if one has surgery in an ambulatory surgical facility like we have at Deist, we only deal with COVID negative patients. So every patient that has an op has a COVID test. And because all of our procedures are done under local anesthetic with conscious sedation, a very small minority need a general anesthetic, but it's a controlled general anesthetic. They're perfectly safe to have any ophthalmic procedure here, and we have not seen any added risk or vulnerability to COVID infections in the post-operative phase. So my assessment is that it's perfectly safe to have any form of ophthalmic surgery in a facility like ours.
And to your patients, would you say that there's any preventative measurements that are effective?
Well, like all viral infections, a good immunity is key. And it all starts with diet. And if one has a very healthy diet, spaced out with great colorful vegetables with lots of antioxidants, and emphasis on the superfoods like blueberries, etc. Supplementation of vitamin D, because we all tend to be a bit low in our vitamin D despite the lots of sun in this country. Zinc supplementation, a fair amount of exercise. One would go a long way at boosting your immunity to go forward. Exercise, I think, and well-being are well-known factors at improving one's immune system.
And are there any useful tips that you can give us to make living in these COVID times easier or safer?
Well, the usual tips, again, relate to the wearing of masks, and it's an interesting fact that the mask wearing blocks transmission of this virus by up to 70%. I found that people complain to me about their glasses fogging up, and their exercise when they're cycling or running, their glasses fogging up. And a useful tip, which we use all day long here, is to use some micropore, which you can buy from your pharmacist, and by placing a small strip over the bridge of your nose and onto the skin and onto the mask like this, you in fact stop all the hot air fogging up your glasses. I found too that people that wear rubber gloves must discard them frequently. It's a misconception by if you sterilize them with alcohol, that they're safe. The alcohol actually makes little holes in the rubber gloves, and this virus theoretically could get through those holes. Rather wash your hands with soap and water more frequently, or the gloves with soap and water, or at least discard them. I get questions from the contact lens wearing population, whether they're at more risk of getting COVID by wearing contact lenses. Well, it's been shown conclusively that there is no risk of COVID living in contact lenses or their solutions. However, folk are touching surfaces when they prepare to put their lenses in and take them out. The amount of hand to eye or hand to face contact time increases exponentially in contact lens wearers. So my advice would be to wear glasses more frequently. If you're ever considering laser, this may be the time, a more appropriate time to think about that. But essentially, you need to wash your glasses and sanitize them more frequently, and of course be cognizant of your hands going to your eyes all the time. And I want to just stress, of course, social distancing and the washing of hands frequently. It is very, very important. And I notice the UK government, Boris, is advocating frequent washing of hands. Funny enough, ahead of masks, in my view, masks and hand washing go hand in hand together.
Thank you so much for your time and your advice.
My pleasure. I hope that helps people feel more comfortable these times.
I'm sure it will.